The nurse presses gently on the prisoner's left thigh and the prisoner screams, not from pain but from terror. The prisoner's name is Reinhard. He is 20 years old. He has a jagged scar on his left thigh from a shrapnel wound he received 4 months ago in Italy. The wound healed on the outside but never properly on the inside. Now it is infected and swollen. Reinhard tells the nurse through an interpreter that he can feel the shrapnel fragment moving under his skin when he walks or when pressure is applied. The nurse, Lieutenant Margaret Collins, thinks Reinhard is imagining it. Embedded shrapnel does not move. It becomes encased in scar tissue and stays in place. But when Collins palpates the infected area, she feels something shift beneath her fingers. A hard object, roughly the size of a large marble, sliding through fluid and infected tissue. Collins pulls her hand back in shock. Reinhard is not imagining anything. The shrapnel is moving, and if it moves far enough in the wrong direction, it could sever his femoral artery and kill him in minutes. We are at Camp Shanks in New York in October 1944, 3 months after the liberation of Paris. The camp is a major processing and transit facility for prisoners of war arriving from Europe. Approximately 5,000 German and Italian prisoners pass through Camp Shanks every month, undergoing medical screening, delousing, and assignment to permanent camps across the United States. Most prisoners spend only 3 to 5 days at Camp Shanks before being transferred elsewhere. The medical screening is supposed to identify serious health issues that require immediate treatment. Reinhard's shrapnel wound should have been caught during this screening. It was not. Reinhard arrived at Camp Shanks 2 days ago on a transport ship from Liverpool. He went through the standard medical screening, temperature check, visual inspection for wounds or illnesses, basic questions about medical history. The medic who screened Reinhard saw the scar on his left thigh and asked what it was. Reinhard explained through an interpreter that he was wounded by shrapnel in Italy 4 months ago. The wound healed. The medic noted this in Reinhard's file and moved on to the next prisoner. Reinhard was cleared as healthy and assigned to a barracks, but the wound had not actually healed. The skin closed over the shrapnel fragment, trapping it inside along with bacteria and dead tissue. An abscess formed deep in the muscle, slowly growing over the course of 4 months. 2 days after arriving at Camp Shanks, Reinhard wakes up with severe pain in his left thigh. The area around the old scar is swollen, red, and hot to the touch. Reinhard can barely walk. He reports to Sick Call, the daily medical clinic for prisoners with complaints. He is seen by Collins, a surgical nurse with 3 years of Army experience. Collins examines the thigh and immediately recognizes the signs of a deep tissue infection. But what happens next shocks her. When she presses on the swollen area to assess the extent of the infection, she feels the shrapnel fragment move. Reinhard feels it too and panics. He says in broken English, "It moves, it moves." Collins calls for the camp doctor, Captain Robert Hensley, immediately. We are still at Camp Shanks, and Hensley is examining Reinhard's leg. Hensley has been an Army surgeon for 5 years and has treated hundreds of shrapnel wounds. He knows that embedded shrapnel becomes encapsulated by the body in fibrous scar tissue, essentially cementing it in place. Shrapnel does not move unless it was never properly encapsulated, which suggests the wound was not treated correctly after the initial injury. Hensley asks Reinhard through the interpreter, Corporal Stephen Walsh, to describe how he was wounded and what treatment he received. Reinhard explains that he was hit by an artillery shell explosion during the Battle of Anzio in June 1944. Multiple shrapnel fragments struck his body. Most were superficial and were removed by a German medic in the field. But one fragment lodged deep in his left thigh. The medic said it was too deep to remove without surgery and that Reinhard would need to go to a field hospital. Reinhard never made it to a field hospital. His unit was surrounded by Allied forces and surrendered 3 days after he was wounded. Reinhard was taken to a temporary prisoner holding area where an American medic examined his wounds. The medic cleaned the superficial injuries, but said the deep thigh wound had already closed over and seemed to be healing. The medic bandaged it and told Reinhard to keep it clean. Reinhard spent the next 2 months in various holding camps and transit facilities. The wound seemed fine. There was no pain, no swelling, no discharge. The skin healed over completely, leaving only a scar. Reinhard thought he was lucky. The shrapnel was inside him, but it was not causing problems. He was wrong. Hensley explains to Reinhard what happened. When the wound closed over the shrapnel, it trapped bacteria inside. The body tried to fight the infection but could not fully eliminate it because the shrapnel was a foreign object. The infection became chronic, slowly eating away at the tissue surrounding the shrapnel. Instead of the shrapnel becoming encapsulated in stable scar tissue, it became suspended in a pocket of infected fluid and necrotic tissue. Now, 4 months later, the infection has expanded to the point where the shrapnel can move freely within the abscess cavity. Every time Reinhard walks or applies pressure to the area, the shrapnel shifts. The danger is that the shrapnel could migrate toward major blood vessels or nerves. If it punctures the femoral artery, Reinhard will bleed out in minutes. If it damages the femoral nerve, he could lose function in his leg permanently. We are still at Camp Shanks, and Hensley is explaining to Reinhard that he needs emergency surgery. The shrapnel must be removed immediately. The abscess must be drained and cleaned. The infected tissue must be debrided. If this is not done within the next 12 to 24 hours, Reinhard is at risk of sepsis, arterial rupture, or permanent nerve damage. Reinhard asks through Walsh how dangerous the surgery is. Hensley is honest. The shrapnel is close to the femoral artery and nerve. Removing it requires precision. There is a risk of accidentally cutting the artery or nerve during the procedure, but leaving the shrapnel in place is more dangerous. Reinhard agrees to the surgery. He has no real choice. Collins prepares Reinhard for surgery. She starts an intravenous line for fluids and antibiotics. She administers a dose of sulfa drugs, the strongest antibiotics available in 1944. The antibiotics will help fight the infection, but they cannot remove the shrapnel. Only surgery can do that. Reinhard is moved to the camp surgical unit, a small operating room with basic equipment. Hensley scrubs in along with Collins and another nurse. The anesthesiologist, Captain James Morton, administers spinal anesthesia to numb Reinhard from the waist down. Reinhard will be conscious during the surgery, but will not feel pain in his leg. This is safer than general anesthesia, given Reinhard's infected state. Hensley makes an incision over the old scar, cutting through skin and subcutaneous tissue. When he reaches the abscess, pus erupts from the wound, thick and yellow-green. Hensley suctions out the pus and irrigates the cavity with sterile saline. The abscess cavity is large, approximately the size of a tennis ball, hollowed out by 4 months of chronic infection. Hensley probes the cavity carefully with forceps and locates the shrapnel fragment. It is a jagged piece of metal, roughly 3 centimeters long and shaped like an irregular triangle. The fragment is loose, moving easily when Hensley touches it. He positions the forceps around the fragment and gently extracts it. The metal comes out cleanly. Hensley drops it into a metal tray with a clink. 1 piece of shrapnel, 4 months late. We are still in the operating room, and Hensley is examining the abscess cavity now that the shrapnel is removed. What he sees makes him realize how close Reinhard came to disaster. The femoral artery runs directly along the bottom edge of the abscess cavity. Hensley can see it pulsing, exposed by the infection that ate away the surrounding tissue. The shrapnel fragment was less than 5 millimeters from the artery. If it had shifted just slightly further down, it would have punctured the arterial wall. Hensley shows Collins and says quietly that Reinhard is extraordinarily lucky. Collins asks what would have happened if the shrapnel had hit the artery. Hensley says Reinhard would have bled to death before they could get him to an operating room. The femoral artery carries a massive volume of blood. A puncture would cause bleeding that cannot be stopped with pressure alone. Hensley carefully cleans the abscess cavity, removing all the infected and dead tissue. He irrigates with liters of saline until the fluid runs clear. He examines the femoral artery and nerve under magnification to ensure neither was damaged. Both appear intact. Hensley packs the wound cavity with antibiotic-soaked gauze, leaving it open to drain rather than closing it. Closing the wound now would trap any remaining infection inside. The wound will heal from the inside out over the next several weeks. Hensley places a surgical drain, a rubber tube that will allow fluid to escape as the cavity heals. He bandages the leg and steps back. The surgery has taken 90 minutes. Reinhard is stable, the shrapnel is out. The crisis is over. Let us know in the comments where you are watching this from. Are you in the United States, Germany, the United Kingdom, or somewhere else? We would love to know who is keeping these stories alive. Morton stops the spinal anesthesia, and Reinhard begins to regain feeling in his legs. The first thing Reinhard says when he can speak clearly is a question in German that Walsh translates. Is the metal out? Hensley shows Reinhard the shrapnel fragment in the metal tray. Reinhard stares at it, this piece of metal that has been inside his body for 4 months, moving around, threatening his life. He says something else in German. Walsh translates. Reinhard said he thought he was going to die when he felt it moving. Hensley tells Reinhard through Walsh that he almost did die, but he is safe now. We are now 3 days after Reinhard's surgery, and he is recovering in the camp hospital. Now, we go back 4 months to June 1944 to understand how Reinhard ended up with a mobile shrapnel fragment. We are at the Anzio beachhead in Italy, where Allied forces have been locked in brutal fighting with German defenders for 5 months. Reinhard was part of a German infantry unit dug into defensive positions south of Rome. His unit was under constant artillery bombardment. Reinhard spent his days in a foxhole, eating cold rations, sleeping in shifts, and trying not to get killed. On June 10th, an American artillery shell landed 10 meters from Reinhard's foxhole. The explosion threw him against the side of the foxhole and peppered his body with shrapnel. Reinhard regained consciousness to find blood soaking through his uniform in multiple places. His left thigh hurt worse than anything he had ever felt. He looked down and saw blood pooling around his leg. A German medic crawled to Reinhard's foxhole and examined him. The medic found 6 shrapnel entry points, 2 in the right arm, 1 in the left shoulder, 2 in the abdomen, and 1 in the left thigh. The medic removed the superficial fragments from the arm, shoulder, and abdomen using forceps. Those pieces were just under the skin and came out easily, but the thigh wound was different. The medic probed it and found that the fragment was deep in the muscle. He told Reinhard that trying to remove it in the field could cause uncontrollable bleeding. Reinhard needed proper surgery in a field hospital. The medic bandaged all the wounds and gave Reinhard a morphine injection. Reinhard was supposed to be evacuated that afternoon, but the evacuation convoy never arrived. The roads were under heavy artillery fire and no vehicles could get through. Reinhard spent 2 more days in the foxhole, his wounds covered with bloody bandages, waiting for evacuation that never came. On June 13th, American infantry overran Reinhard's position. Reinhard and 30 other survivors surrendered. An American medic examined Reinhard's wounds and found that the superficial ones were healing and the thigh wound had stopped bleeding. The skin had started to close over the entry point. The medic cleaned the wounds with antiseptic and applied fresh bandages. He did not attempt to remove the deep shrapnel. Reinhard was taken to a holding camp and the waiting began. If you want to dive even deeper into these untold stories, consider becoming a channel member. You'll get your name mentioned in the video, early access to videos, exclusive content, and direct input on which stories we cover next. Join our inner circle of history keepers. We are still tracing Reinhard's journey before Camp Shanks, and now we follow the 4 months during which the chronic infection developed. From the holding camp in Italy, Reinhard was moved to a larger transit camp where he spent 3 weeks. His wounds continued to heal on the surface. The pain in his thigh decreased. Reinhard assumed he was recovering. He had no idea that beneath the closed skin, bacteria were multiplying around the trapped shrapnel. In July, Reinhard was transferred to a camp in North Africa for processing before transport to the United States. He spent 6 weeks there, working on light duty, carrying supplies and cleaning equipment. The thigh felt stiff but not painful. Reinhard could walk and work normally. The infection was spreading slowly, eating away at tissue, but not causing obvious symptoms yet. In September, Reinhard was loaded onto a transport ship bound for America. The voyage took 16 days. During the crossing, Reinhard noticed the thigh felt strange sometimes. When he walked up and down the ship's ladders, he felt an odd sensation, like something shifting inside his leg. He mentioned it to another prisoner who said it was probably scar tissue settling. Reinhard accepted this explanation. When the ship docked in New York, Reinhard was taken to Camp Shanks. The thigh was slightly swollen but not dramatically so. The medic who screened Reinhard saw the scar and asked about it, but Reinhard said the wound was 4 months old and healed. The medic believed him and cleared him for transfer. If you are enjoying this story and want more untold accounts from World War II prisoners of war, make sure to subscribe to the channel. We are bringing you stories that most history books never covered. 2 days later, the abscess reached critical size and became acutely symptomatic. The swelling increased rapidly. The pain became severe. Reinhard could barely walk. That was when he went to sick call and Collins discovered the mobile shrapnel. Reinhard had been walking around for 4 months with a slow-motion disaster building inside his leg. The infection was like a time bomb, quietly ticking, waiting for the moment when it would become life-threatening. Reinhard reached that moment at Camp Shanks, but he was lucky. He reached it in a place with a surgical unit and a skilled surgeon. If the crisis had happened on the transport ship or in a holding camp with no medical facilities, Reinhard would have died. We returned to Camp Shanks, and Reinhard is now 1 week post-surgery. The recovery is not smooth. On the 3rd day after surgery, Reinhard develops a high fever, 103 degrees, indicating the infection is still active despite the antibiotics. Hensley increases the antibiotic dosage and changes the wound packing daily to ensure drainage. The fever persists for 4 days. Reinhard becomes delirious at times, speaking in German, crying for his mother. Collins and the other nurses monitor him constantly, administering fluids and medications, changing bandages, checking vital signs. On the 7th day, the fever breaks. The infection is finally clearing. Reinhard regains lucidity and starts to eat solid food again. The wound itself heals slowly. The abscess cavity is large and deep, and it must heal from the inside out to prevent the infection from being trapped again. Collins changes the packing daily, removing the old antibiotic-soaked gauze and inserting fresh material. The process is painful for Reinhard, even with morphine. Each dressing change takes 20 minutes and leaves Reinhard exhausted and sweating. But gradually, the cavity fills in with healthy granulation tissue. The drainage decreases. The swelling reduces. By the end of the 3rd week, the wound is nearly healed. Hensley removes the surgical drain and allows the outer skin to close. Reinhard is left with a large scar that covers half his left thigh, but the infection is gone and the shrapnel is out. Reinhard asks Hensley if he can keep the shrapnel fragment. Hensley gives it to him in a small glass vial. Reinhard holds the vial and stares at the piece of metal that nearly killed him. He says through Walsh that he wants to keep it as a reminder of how close he came to dying. Collins asks if looking at it will give him nightmares. Reinhard says maybe, but he still wants it. The shrapnel is proof that he survived something most people do not survive. Hensley tells Reinhard he is medically cleared to transfer to a permanent camp. Reinhard will need physical therapy to rebuild strength in his left leg, but he should make a full recovery. The mobility in his leg is intact. The nerve damage Hensley feared did not occur. Let us pause Reinhard's personal story and examine the larger context of embedded shrapnel among combat, wounded soldiers and prisoners of war. Medical records from World War II indicate that shrapnel wounds were the most common type of combat injury, accounting for approximately 60 to 70% of all battlefield casualties. Most shrapnel fragments were small and superficial, easily removed by medics in field hospitals. But a significant percentage, estimated at 10 to 15%, involved fragments that were deeply embedded in muscle, near vital structures, or too dangerous to remove immediately. These fragments were often left in place with the assumption that the body would encapsulate them in scar tissue. This assumption was generally correct. The human body is remarkably good at isolating foreign objects through fibrosis. But the process requires that the wound be properly cleaned and that infection be prevented or treated early. When infection was present at the time the wound closed, as in Reinhard's case, the encapsulation process failed. Instead of forming stable scar tissue, the body formed an abscess cavity filled with pus and necrotic tissue. The shrapnel remained mobile within this cavity, creating a delayed threat that could emerge weeks or months after the initial injury. Medical literature from the 1940s and 1950s contains numerous case reports of patients who developed mobile shrapnel complications months or years after being wounded. The specific danger of mobile shrapnel near major blood vessels was well understood by military surgeons. The femoral artery is one of the largest arteries in the body, carrying approximately 1 liter of blood per minute through the thigh. A puncture or laceration of this artery causes rapid exsanguination. Even with immediate surgical intervention, the mortality rate for femoral artery injuries in the 1940s was approximately 30 to 40%. Reinhard's shrapnel fragment was positioned such that any migration of 5 millimeters in the wrong direction would have been fatal. The fact that the fragment moved for 4 months without hitting the artery is remarkable. Hensley later told Collins that Reinhard was one of the luckiest patients he had ever treated. One more day, one more step, and the outcome could have been entirely different. We returned to Reinhard 5 weeks after his surgery, and he is now cleared to transfer to a permanent camp. But before he leaves Camp Shanks, Hensley wants to discuss the psychological impact of Reinhard's experience. Hensley has noticed that Reinhard is anxious and hypervigilant. Reinhard constantly checks his thigh, feeling it through his clothing, making sure nothing is moving. He limps even though the leg has healed well and should not be painful. Hensley examines the leg and finds no medical reason for the limp. He realizes Reinhard is afraid to put full weight on the leg, afraid that something will go wrong again. This is a psychological injury, not a physical one. Hensley talks to Reinhard through Walsh about what he is feeling. Reinhard says he has nightmares about the surgery and about the feeling of the shrapnel moving inside him. He says sometimes he wakes up and feels like the shrapnel is still there, still shifting, still threatening to kill him. He knows intellectually that the shrapnel is gone. He has it in the glass vial, but the fear remains. Hensley explains that this is a normal response to trauma. Reinhard experienced a life-threatening situation where his own body was betraying him. The shrapnel, which should have been inert and harmless, became an active threat. That kind of experience leaves psychological scars just as real as physical scars. Hensley recommends that Reinhard talk to other prisoners who have had similar experiences. Sharing stories and fears with people who understand can help process the trauma. Hensley also tells Reinhard to gradually increase weight bearing on the leg during physical therapy. The limp will go away once Reinhard regains confidence in the leg. Reinhard agrees to try. Over the next 2 weeks before his transfer, Reinhard attends group sessions with other wounded prisoners. He hears stories of men who lost limbs, men who have shrapnel that could never be removed, men who live with chronic pain from old injuries. Reinhard realizes his outcome was relatively good. He has both legs. The shrapnel is out. He survived. The nightmares continue but become less frequent. We are now in December 1944, and Reinhard is being transferred to Camp Pine in New Jersey, a permanent prisoner of war camp where he will spend the rest of his captivity. Reinhard's medical file travels with him, documenting the shrapnel wound, the infection, the emergency surgery, and the recovery. The file includes a note from Hensley recommending continued physical therapy and psychological monitoring. Reinhard arrives at Camp Pine and goes through intake processing. The camp doctor, Captain Lawrence Foster, reviews Reinhard's file and examines his leg. The surgical scar is large and still pink, but it is healed. Foster tests Reinhard's strength and mobility and finds both adequate. Foster assigns Reinhard to light work duty for 1 month while he completes physical therapy. Reinhard works in the camp library, shelving books and helping prisoners find reading material. The work is easy and keeps him indoors during the cold New Jersey winter. Reinhard appreciates the assignment. It gives him time to continue healing physically and mentally without the demands of hard labor. Other prisoners ask about his scar, and Reinhard tells the story of the mobile shrapnel. Some prisoners do not believe him. They think he is exaggerating. Reinhard shows them the glass vial with the shrapnel fragment and describes the surgery. The prisoners look at the jagged piece of metal and realize Reinhard is telling the truth. The story spreads through the camp. Reinhard becomes known as the prisoner who had metal moving inside his leg. Over the next 6 months, Reinhard fully recovers. The limp disappears. The anxiety decreases. The nightmares become rare. Reinhard completes physical therapy and is cleared for regular work duty. He is assigned to a farm detail, working in fields, planting and harvesting crops. The work requires physical strength, and Reinhard proves he has regained it. His left leg is slightly weaker than his right leg, but the difference is minor and does not affect his functionality. By the summer of 1945, Reinhard is indistinguishable from any other healthy prisoner. The infected wound and mobile shrapnel are part of his past, documented in his medical file but not visible to anyone who meets him. We are now in May 1945, and the war in Europe is over. Germany has surrendered unconditionally. Reinhard is still at Camp Pine, working on farm details and waiting for repatriation. The news of surrender brings complicated emotions. Reinhard is relieved the killing has stopped but worried about his family. He grew up in Hamburg, which was heavily bombed by Allied air raids. Reinhard has received 1 letter from the Red Cross confirming his parents are alive, but he knows nothing about the condition of his city or his home. He writes letters asking for more information, but responses are slow. Reinhard waits and works and tries not to think too much about what he will find when he goes home. The camp atmosphere changes after the war ends. Prisoners are given more freedoms, more educational opportunities, more recreational activities. Reinhard enrolls in an English language class and discovers he has a talent for languages. He also takes a carpentry class, learning to build furniture and repair structures. These skills will be useful in post-war Germany, where reconstruction will require every able body and every practical skill. Reinhard thinks about his future. He wants to learn a trade, maybe become a carpenter or a mechanic. He wants to help rebuild his country. The war destroyed so much. Reinhard survived the destruction. Now he wants to be part of creating something new. We are now in early 1946, and Reinhard is approved for repatriation. He boards a transport ship in March with 800 other German prisoners. The voyage back to Europe takes 2 weeks. Reinhard spends the time on deck, watching the ocean, thinking about the last 2 years. He was wounded at Anzio. He carried infected shrapnel for 4 months without knowing it. He nearly died from a mobile fragment that almost severed his femoral artery. He was saved by an American surgeon and nurse who treated him as a patient, not an enemy. Reinhard survived, and now he is going home. The journey feels circular, an ending and a beginning at the same time. When the ship docks in Bremen, Reinhard goes through repatriation processing. He is questioned about his military service, checked for Nazi party affiliation, and given identity papers. Reinhard is classified as low risk and cleared for release. He boards a train to Hamburg. The journey takes 2 days. When Reinhard arrives, he finds a city that barely exists anymore. Entire neighborhoods are gone, reduced to rubble by bombing. The train station is a shell, but his parents' apartment building, miraculously, is still standing, damaged but habitable. Reinhard climbs the stairs and knocks on the door. His mother opens it. She stares at him for a long moment, as if she cannot believe he is real. Then she pulls him into her arms and does not let go. Chapter: The life after Reinhard spends the next several years working in Hamburg's reconstruction efforts. He uses the carpentry skills he learned at Camp Pine to find work repairing buildings and constructing temporary housing. The work is hard and the pay is minimal, but it is steady. In 1948, Reinhard marries a woman named Greta who works as a nurse at a local hospital. They bond over their shared experiences with medical care, Reinhard as a patient, Greta as a caregiver. They have 2 children over the next decade. Reinhard builds a stable, ordinary life. He rarely talks about the war or the mobile shrapnel. When people notice his scar, he says he was wounded in Italy and had surgery in America. He does not go into details. The glass vial with the shrapnel fragment stays with Reinhard for his entire life. He keeps it in a drawer in his bedroom, taking it out occasionally to look at it. His children find it when they are young and ask what it is. Reinhard tells them it is a piece of metal that was inside him during the war. His children are fascinated and horrified at the same time. Reinhard uses the shrapnel as a teaching moment. He tells his children that small decisions have big consequences. If he had reported the wound earlier, if he had insisted on proper treatment, the infection might never have developed. The shrapnel might have been removed safely. But Reinhard made choices based on fear and ignorance, and those choices nearly cost him his life. The lesson is to speak up, to seek help, to not suffer in silence. Reinhard lives into his 70s and dies in 1994, 50 years after the mobile shrapnel nearly killed him. The scar on his left thigh is still visible when he dies, a permanent reminder of the 4 months he carried a time bomb in his leg. His family finds the glass vial with the shrapnel fragment among his belongings. They keep it as a family heirloom, a tangible piece of history that connects them to their father's wartime experience. The shrapnel, which caused so much suffering when it was inside Reinhard's body, becomes a symbol of survival and resilience after his death. We shift focus now to Lieutenant Margaret Collins and Captain Robert Hensley and what happened after Reinhard's case. Collins continued working as a surgical nurse through the end of the war and into the post-war period. She treated thousands of prisoners at Camp Shanks, but Reinhard's case remained one of the most memorable. Collins later told colleagues that feeling the shrapnel move under her fingers was one of the most unsettling experiences of her medical career. She had read about mobile foreign bodies in textbooks, but experiencing it in real time was completely different. The case reinforced for Collins the importance of thorough examination and not dismissing patient complaints as imaginary. Hensley wrote a detailed case report on Reinhard's mobile shrapnel and submitted it to a military medical journal. The report was published in 1946 under the title Delayed Complication of Retained Shrapnel, a case of mobile fragment near femoral artery. The article described the mechanism of infection preventing encapsulation, the risks of vascular injury, and the surgical technique for safe removal. Hensley used the case to argue that all deeply embedded shrapnel should be reevaluated periodically, even if the wound appears healed. The article was cited in subsequent medical literature and influenced protocols for managing retained foreign bodies in combat casualties. What does Reinhard's story tell us about World War II and the medical challenges of treating combat casualties? On one level, it is a story about the complexity of shrapnel wounds. What appears to be a healed wound can hide a developing catastrophe. The decision to leave deeply embedded shrapnel in place is often medically sound when proper wound care is provided. But when infection is present, the calculus changes. The foreign body becomes a focus for chronic infection that can lead to abscess formation, tissue destruction, and life-threatening complications. Reinhard's case demonstrates what happens when battlefield medicine cannot provide definitive treatment and when follow-up care is inadequate or absent. On another level, Reinhard's story is about the value of patient testimony. When Reinhard said he felt the shrapnel moving, he was telling the truth. Collins and Hensley could have dismissed his complaint as anxiety or imagination. Instead, they investigated and discovered that Reinhardt's subjective experience was medically accurate. The shrapnel was moving. Trusting patient reports, even when they seem unlikely or impossible, is a fundamental principle of good medicine. Reinhardt's life was saved because medical providers listened to him and took his complaints seriously. The shocking moment when Collins felt the shrapnel shift under her fingers was shocking because it violated expectations about how shrapnel behaves in the body. Embedded foreign objects are supposed to be stable, encapsulated, inert. Reinhardt's shrapnel was none of those things. It was mobile, threatening, and actively dangerous. The shock was the realization that Reinhardt was literally carrying a potential death sentence inside his leg, visible only as an old scar, but containing a fragment that could kill him with one wrong move. That Collins discovered the problem in time, that Hensley successfully removed the fragment without catastrophic complications, and that Reinhardt survived and recovered fully, is testament to the skill and dedication of military medical personnel and to the resilience of the human body. Reinhardt carried the shrapnel for 4 months and survived. The infection that should have killed him was controlled. The surgery that could have caused arterial rupture went perfectly. The recovery that could have been complicated by sepsis or nerve damage proceeded without major setbacks.